Dogs love to explore their surroundings, but sometimes they can get into trouble. So if your dog is bitten by a pit viper, it's important to know what to do and what not to do. In this video, we'll talk about that, especially what not to do if your dog is bitten by a pit viper or a snake. Pit vipers are highly venomous snakes. The bite site often swells, becomes sore to the touch, and may appear blue. If your dog is bitten, the signs of envenomation may not be immediately apparent, but depending on the type of snakebite and the amount of venom injected, a dog could die within 30 minutes to 2 hours if urgent care is not given. Obviously, no one would ever want their furry friend to be in this position. The first thing you should do is take your dog to the vet immediately. The veterinarian will evaluate the severity of the bite and assess the condition of your dog. They may also perform tests to determine the level of venom in your dog's bloodstream and monitor vital signs such as heart rate and blood pressure. Depending on the severity of the bite, the vet may administer anti-venom medication to counteract the effects of the venom. They may also provide supportive care such as pain management, fluid therapy, and wound treatment. The vet will also give you specific instructions on how to care for your dog at home, including monitoring for any signs of complications or infections. It's important to follow their instructions closely and to bring your dog back for follow-up visits as needed. Most pets will recover with prompt and appropriate treatment, but snake bites can be fatal. There are higher fatality rates for dogs who are bitten on the tongue or the chest and for pets who have a long delay between the time of the bite and treatment by a veterinarian. Now here is what not to do. First of all, do not try to capture or kill the snake. This is dangerous and could result in another bite. Also, it's important to know that not all snake bites are from pit vipers. Trying to identify the snake can waste valuable time and put you and your dog at risk. Another mistake is applying a tourniquet. This can actually make things worse by trapping the venom in the limb and causing tissue damage. It's best to keep the affected limb still and below the level of the heart to slow down the spread of venom. Sucking out the venom is also not recommended. This is ineffective and can introduce bacteria into the wound, causing infection. Plus, it's not safe for the person trying to do it. Do not give your dog over-the-counter pain medication. Some of these medications can actually make the situation worse by thinning the blood and causing more bleeding. Always consult with a veterinarian before administering any medication to your dog. Remember, staying calm and seeking immediate veterinary attention is the best thing you can do for your dog if they are bitten by a pit viper. Don't panic and avoid these common mistakes. Lastly, avoid movements so the venom does not spread around the lymphatic system. The less they move, the more time you have to take them to the vet. Remember, early intervention is critical in treating pit viper snake bites in dogs, and prompt veterinary care can make all the difference in ensuring your furry friend recovers quickly and fully. So stay vigilant, keep your dog safe, and seek help immediately if you suspect they have been bitten by a pit viper. Thanks for watching this video, and we hope you enjoyed spending time with us. If you're a dog lover like us, make sure to hit that subscribe button and join our community of fellow dog enthusiasts. If you have any questions or suggestions for future videos, please leave them in the comments below. And if you want to see more informative and entertaining content featuring dogs, check out our other videos on this channel. Remember, dogs are more than just pets. They're loyal companions, best friends, and an endless source of love and joy. So give your furry friend a hug and a treat, and we'll see you in the next video.